Bismillahirrahmanirrahim. Assalamu alaikum wa rahmatullahi wa barakatuh. Good evening, dear viewers, ladies and gentlemen. Hello and welcome. Dr. Mohammed Alsheef, your host of Elixir of Life, is kicking off another inspiring and informative episode with our distinguished guest, bringing you the most up-to-date information and exploring new frontiers and discussing cutting-edge advances in medical imaging. Our program is filled with many inventive segments, most importantly our topic of the week with our distinguished guest. Stay tuned for a special episode. Once again, welcome back to Elixir of Life. Our next segment will be the quote of the week. Please stay with us. Once again, welcome back to Elixir of Life. Our next segment will be medical imaging. We'll be talking about the 11th conference of the Saudi Society of Neurosurgery. To watch more details about this report, stay with us.
With me here is Professor Franco Servadi, the President-elect of the World Federation for Neurosurgical Societies. Good evening, Professor.
Good evening.
Professor, could you tell us a little bit about the importance of this meeting in Saudi Arabia? Of course, you're a president of a world society, world federation. So, what is the importance, and how can we use the federation here in Saudi Arabia in a world base?
This is. I am very happy that I was invited by the Saudi Society and by the Arabic Pediatric Society to come here. This is an outstanding meeting, very well organized, with very good scientific sessions, also with very good educational sessions. I think Saudi Arabia, it's important for the World Federation. We need to include the educational track of the World Federation Saudi Arabian speakers. We need to include in our education trainees from Saudi Arabia, and we need to use your structure to train surgeons from countries with limited facilities of this area.
With me here is Professor Ahmed Amar, Professor of Neurosurgery from Imam Abdurrahman bin Faisal University of Dammam. Good evening, Professor.
Good evening.
Professor, could you tell us a little bit about this event? How do you see its importance so far?
Well, I think this event is very special this year, as it is a joint between the Saudi Association of Neurosurgery Annual Conference and the second meeting of Arab Pediatric Neurosurgery Society. And this is a very important meeting, and so many delegates from more than 20 or 30 countries, they participated in this meeting.
Indeed. Doctor, can you tell us a little bit about the lecture that you will be presenting? What is it about, and what's the importance of that?
I'm talking about the future of neurosurgery. Neurosurgery has developed a lot in the last decades, but we think that is the future carries a lot of promising for the neurosurgery. So we talk about how the coming neurosurgery will be practiced, how is the use of navigations, how is the use of stem cells, how is the use of gene therapy, also how is the use of robotic surgery. So there are many things are coming up, and I think it will help many patients.
Once again, welcome back to Elixir of Life. Our next segment will be talking about health myth and fact. To watch more details about this report, stay with us. Once again, welcome back to Elixir of Life. Now we are coming to the most important segment. Our topic of the week is we are talking about the role of radiology in diagnosis and management of diseases. Remember, radiology is the eye of medicine. It's my intense pleasure and honor to welcome my distinguished and esteemed guest, Dr. Abdullah AlDosary. He's consultant radiologist and chairman of body imaging department at King Fahd Medical City. Welcome, Dr. Abdullah.
Thank you very much, Dr.sheef. Bismillah, salatu wassalamu ala rasulillah, ala alihi wa sahbihi ajma'in. Thank you very much for having me as a guest in your program. It's a great pleasure to be here, and it's a great pleasure to be of help to our patients watching this channel, and to our colleagues as well.
Thank you very much. Without further ado, we'll start our discussion. We have very important questions. We're starting first by what's or who's a radiologist?
To make things clear, radiologists are doctors, physicians that have finished medical school and decided to subspecialize or specialize in the diagnosis of diseases using radiological modalities, whether X-ray, CT, MRI, or ultrasound. There's some confusion sometimes between the role of a radiologist and the role of radiology technologist. The role of a radiology technologist is to obtain the images from the patient, either through the X-ray or ultrasound, whatever modality, and prepare the patient for this examination, instruct him during the examination, and after the exam is done, he sends the images to a radiologist, who then interprets the findings in the images and comes with a possible cause of the patient's complaints, and formulates a report. And this report then goes to the treating physician, who, based on the imaging findings and based on the other data that the physician has, he decides what's the illness of the patient, what's wrong with him, and what's the proper treatment plan.
Excellent. So radiologist is a physician who completed medical school and training, okay?
Yes, we are physicians that finished 7 years of medical school, and we have a background of the different diseases It can happen to the human being, and we interact with our colleagues also in the rest of the medical field, whether in medicine, surgery, obstetrics and gynecology, or other modalities. Yes.
Excellent. What's medical imaging and radiology?
Well, medical imaging is the study or the assessment of patients using different radiological modalities to come with a possible cause or causes of the patient's disease. Of course, what kind of modality to use, that depends on the clinical presentation of the patient and the question to be answered by the physician after having a good assessment of the patient. It has two, in general, it's a diagnostic modality, but there's also an interventional side to radiology called interventional radiology, where we use image-guided procedures under ultrasound guidance or under CT guidance or X-ray guidance to target a structure and either treat or get a diagnosis using interventional radiology.
Excellent indeed. Dr. Abdullah, what are the types of medical imaging?
Well, the types of medical imaging modalities are variable. Some of them have ionizing radiation, such as X-rays, mammography, fluoroscopy, CT scans, nuclear medicine, and some of them have no ionizing radiation. So they basically they don't harm the patient. Ionizing radiation can cause some minimal harm at the diagnostic level, but some of them don't have ionizing radiation, such as ultrasound and MRI. The X-ray, fluoroscopy, and CT, all these machines that have an X-ray tube producing what's known as X-rays, and these X-rays, they penetrate the human body, and they are detected on the other side by what we call a detector or a film in the old days, and an image is created. And us as radiologists during our training, we know what's the normal appearance of different structures in different modalities, and when we see that the appearance in the film or on the X-ray is different than normal, then based on that we interpret the possible abnormalities and what are the possible causes.
Excellent, Dr. Abdullah. What's interventional radiology? Because I think this is emerging, subspecialty in radiology.
Yes. Well, interventional radiology, as we said, we use image-guided procedures. So, for example, if a patient comes with a mass in the neck, and they want to take a tissue from that mass and to have a diagnosis, and they want to take this tissue under image guidance so they can avoid vital structures like the vessels in the neck or the airway or something. So they do a scan, and under the scan they introduce a needle or a catheter into that structure and take tissue or drain that area of abnormality if it's a collection or something else. So it's basically using different imaging modalities to guide certain procedures. So it will become minimally invasive and either help get a diagnosis, take tissue, or help treat the patient for example, if it's a collection or accumulation of fluid.
Very important. So it's kind of non-invasive or minimally invasive. Yeah. So replaced surgery, because in the past, such masses or lymph node, we go for the classical surgical approach.
Yes. Before, many of the procedures used to be quite invasive. They need to send the patient, put the patient under general anesthesia, and open the patient body, whether chest or abdomen, and take a tissue or drain a collection or drain the fluid. Now, with a less invasive technique, they can do it without anesthesia, without general anesthesia. They can use only local anesthesia, and they obtain the same result or very similar results in many of the time.
So it's used, interventional radiology can be used for diagnostic purposes. What about therapeutic? So can we use it for therapy like injection?
Yes, of course. For example, for vascular interventional radiology, if the patient has an aneurysm, which is a dilatation of the blood vessel, that can be treated using interventional radiology, or if the patient has a thrombosis of the vessel, that can be also treated. Some vascular congenital malformations in the brain or in the body, they can be also thrombosed or occluded using under interventional radiology guidance. So it's done by an interventional radiologist. Some of the procedures are also shared by other subspecialties, for example, vascular surgery or neurosurgery, or cardiology. But it was introduced and emerged and perfected by radiologists, and it was shared by other modalities.
Dr. Abdullah, do you think tertiary care hospital can function properly without radiologist or interventional radiologist?
Of course not. I mean, the two main strengths in any hospital is the radiology department and the laboratory, because they give the diagnosis to the physician, who and with that helps him in reaching the correct management plan. So a strong radiology department is vital for any tertiary care or even secondary care hospital to function properly and to evolve.
So, Dr. Abdullah, do you agree it's the eye of the medicine? So we see, diseases through the eye of radiology?
Of course. You cannot see the diseases sometimes inside the human body with a plain eye, but with radiology, you can see what's happening inside the body without cutting it open.
Great, very important. Now, what are the cutting edge or state-of-art medical imaging?
Well, medical imaging is one of the subspecialties where it's highly dependent on technology. So with rapid evolution of technology, also the medical imaging is rapidly evolving. Initially, when medical imaging started, every radiologist is called a general radiologist. He reads every modality, he reads every system. But now with advances in imaging techniques and technology, there's now subspecialization being introduced. There are abdominal radiologists, there are cardiothoracic radiologists, there are neuroradiologists. Basically, every organ system has a radiologist subspecialized in that. Some of the new evolving techniques are, and for example, let's start with CT, is the dual energy CT scan. It's a new CT scan where instead of having one energy of X-rays, we have two energies of X-rays. And based on the data we get from high energy and low energy X-rays, we can characterize the tissues even better. We can know what kind of stones. For example, in kidney stones, we can reduce the amount of contrast used to give to the patient. So it helps a lot in refining our ability to diagnose pathology. Also, in some of the advances are in the field of MRIs. It's functional MRI. We no longer just study the anatomy or the morphology of organs or pathology. We also study the function of the brain, or assess the different tracts of the brain based on their functions. For example, if a patient has a tumor in the brain and you want to assess if that tumor is affecting the speech area or the motor area,
very interesting.
With functional MRI, you can tell if that area is affected or if you expect to harm that area during surgery. It will help also the surgeon plan his surgery. Other advances, for example, is contrast-induced ultrasound. Previously, contrast was part of CT and MRI only.
Sure,
but
yes,
now
first time to hear that contrast can be used for ultrasound.
Yeah, it's been introduced recently. It's basically just micro bubbles, very tiny bubbles that are introduced in a small in the form of saline, and when they are hit by ultrasound waves, they cause changes in the image, and we can study that. Now, this contrast media is very harmless. It's less harmless than the contrast of CT and contrast of MRI. So it can be used virtually in any patient. Patients with renal failure, patients who have heart disease, children, pregnant women, they can all, it can be used safely.
Excellent indeed, Dr. Abdullah. Is a radiologist involved in the decision-making process, or just he will do whatever physician request?
Yeah, well, a successful radiologist and a successful physician have a very good relationship.
Excellent.
They should exchange ideas. They should always talk to each other, especially in difficult cases. A radiologist should involve himself, and he should be involved also in all decision making of any patients, especially in tertiary care hospitals. Of course, in many of the hospitals there's something called multidisciplinary team meeting.
Excellent. Yeah.
which is a meeting between different teams from medicine, from surgery, from pathology, from radiology, to decide on what's the optimum plan to treat the patient. Most of them, they depend vitally on the presence of a radiologist with them to help them reach what's the proper decision. How big is the tumor, for example? Is it resectable, not resectable? After chemotherapy, did the tumor respond? After drainage, did the collection decrease? So yes, a successful radiologist should be a good physician and should interact with his customers, the physicians, of course.
I think that just back to that point, it's important. That's why if we ask for any imaging modality, we have to bring or ask, the radiologist what's the best imaging modality, and we have to bring history and at least targeted history that might be useful. What do you think is history is important for you, or just the question?
Well, I think it should be part of the training of any physician that's requesting any radiological examination on how to write a short, brief, but targeted history.
Targeted history, yes.
So this will help the radiologist interpret the images and come up with a reasonable differential diagnosis based on the clinical presentation and the history provided by the treating physician or the requesting physician. The other thing is the radiologist also knows what's the best modality to assess certain organs, certain pathologies. So, for example, a physician may request an ultrasound to assess a certain organ, while the radiologist recommends a more sensitive or more specific modality based on the history. So yes, if you're in doubt, most of the physicians, they know what to order, but if you're in doubt, pick up the phone, call your radiologist, give him the history, and ask him, what should I request? What's the best modality to answer my question?
Very, very beautiful. And I myself, and I encourage my trainees, to always visit a radiologist. Discuss your case with the radiologist. Some cases are posing diagnostic dilemma, difficult. Even radiologist, he is, he want to, let's say, put the report after discussing the case, because there are some gaps that can be filled, by history.
Yeah, exactly, yes. Not all the cases are straightforward. Some of the cases are puzzling from the clinical and even from the radiological point of view. So if I just send you the report and I expect you to read it and that's it, you may lose some of the findings mentioned in the report, or may not understand them well. And sometimes in the request, some pieces of the history that might be vital might be missing in the request. So yes, visiting the radiologist's office and discussing some of the cases with them is very important and falls in the benefit of the patient at the end.
Dr. Abdullah, what are the indications of medical imaging, or why would I need to have medical imaging?
Well, medical imaging is part of the diagnostic process in many patients. Not all patients require medical imaging, but certain indications. For example, a patient that comes with a lower limb swelling and you want to rule out a thrombus in the lower limb, in the veins of the lower limb, or a patient has abdominal pain and you're not sure what's the cause of his abdominal pain. Is it the bowel? Is it the pelvic organs, or is it the liver? So there are many indications to medical imaging, and no patient should decide which modality is better. This should be left to the treating physician based on what he sees and what he knows and what he studied to decide what's the modality of choice. Don't dictate on your physician what modality you need. Leave it to him and to the radiologist to decide which is better.
Excellent. So you mentioned radiologists come after excellent history and thorough physical examination, lab investigations, then radiological, or medical imaging. So all the sequence, and all of these, complement each other to, fill, let's say, the pieces of the puzzle to reach to history.
Yeah, medical imaging should not be the first line of diagnosis. It should come after proper history and physical examination and maybe some of the lab investigations as well. Then after that, if you decide that imaging is required for this patient, and then be it, yeah. But it shouldn't be the first modality of examination. No.
Yeah, that's very nice. How does a radiologist recognize abnormality in medical imaging?
Well, during the training of a radiologist, he knows what's the normal appearance of different organs in different modalities. How does the heart look on the X-ray? How does it look on the CT? How does the liver look on ultrasound? And how does it look on CT or MRI? After that, he knows, he studies during his training what different pathologies look like. How does, for example, heart disease look on the X-ray? How does liver disease look on the ultrasound or MRI? So it's a long process. We usually know what's the normal, and at the beginning, and what are the different modalities. Then, after the next step, we study the pathology and what does the pathology look on imaging. Of course, different pathologies, they can have the same appearance on imaging. For example, a liver abscess can look like a cancer. So without the proper history, it's very difficult sometimes to decide. And sometimes even the history might be challenging or difficult. So you may end up putting a needle inside and looking what's coming out. Is it pus, or is it blood, or is it tumor? So yes, it's not 1 + 1 = 2. It's a very complex thing. That's why now radiologists are being subspecialized, because the modalities are getting more and more, and the pathologies we are able to recognize are getting more and more. That's why it's important to subspecialize in imaging, especially if you're working in a tertiary care center or in a very busy hospital.
Dr. Abdullah, you highlighted many times the importance of history and physical examination and training. How many years for you as example? How many years of training to be subspecialized or subspecialist in radiology, like your subspecialty colorectal or abdominal imaging?
After the 7 years of medical school,
yes,
most radiology training programs are 4 years. Some of them are 3, some of them are 5, but most of them are 4 years.
In Saudi Arabia is 4 years.
It's 4 years. So after that, you graduate as a general radiologist. Then if you want to continue as such, you can. If you want to subspecialize, different subspecialties have, most of them are 1 year, but some of them are up to 2 or even 3 years, depending on what kind of subspecialty you want to take. If you want to take, for example, diagnostic and interventional neuroradiology, it's a two-year program.
2-year program.
And the different fellowships vary between countries. For example, body imaging fellowship in Saudi Arabia is 2 years training. Abroad, it's 1 year training. So it's quite variable. Let's say in general, it's between to get to be a subspecialized radiologist, for example, in abdominal imaging, you need at least 5 years after medical school.
5 years.
Yes.
So that's quite, long period of training.
It is, and after, and let me tell you something. Even after the 5 or 6 years, you graduate as a junior consultant radiologist in abdominal imaging, being exposed to more cases, having more discussions with your physician. You increase your knowledge and experience and background. So you have a junior consultant and senior consultants, and with practice you learn, and from mistakes you learn. That's why it's very important to have a good rapport with your referring physician colleagues. Well, basically, I like to call them my customers, because they're always in my office. So it's very important, because they teach you, they give you feedback about the imaging. You tell them certain diagnosis, they tell you was it right or was it wrong, so you can also teach yourself.
Excellent. Very fascinating, Dr. Abdullah. What happens during medical imaging examination?
Well, this varies depending what modality. For example, if the patient comes for an X-ray, most of the time there's no preparation needed for the patient. The patient goes to the X-ray room, the technician explains the procedure to him, he does the X-ray, a few minutes later he goes home without any issues. Sometimes, for example, in ultrasound, the patient may need to be prepared. He may need to be fasting for 6 hours or even more, or sometimes the patient may need to have a full bladder.
So this is full bladder for ultrasound
of the pelvis, usually.
Pelvis, okay.
Pelvic ultrasound, especially for female pelvis. And for CT, sometimes the patient may need to be fasting. If he's planned for IV contrast, to be given IV contrast, he may need to do to assess his renal function, his kidney function before before taking IV contrast. He might be given some fluid to drink before the exam. We call this oral contrast. So depending on what kind of need. After the procedure, most of the time there's no issues, but sometimes the patient may be requested to drink a lot of fluid, or frequently go to the bathroom to empty his urinary bladder. So these instructions, you need to ask about them after you finish your examination. So don't go immediately to home. Ask your technologist, are you done? Are there any certain instructions you need to follow after the examination?
So there is before and after, okay,
Yes.
instructions.
Yeah.
So you covered nicely CT, ultrasound. What about MRI? What are the, let's say, prerequisite or preparation for MRI?
Yeah. An MRI stands for magnetic resonance imaging. So an MRI machine is basically a very strong magnet. So it's affected by any ferromagnetic or paramagnetic material, i.e. any metal can be affected by it. So before going for the MRI, you will be asked you'll be basically screened by the technologist or by the nurse if you had any recent surgeries, if you have metal objects in your bodies, if you have any what's known as medical devices such as cardiac pacemakers or cochlear implants or neurostimulators, because many of them are not MRI safe. So you'll be asked about them. Some of them may be MRI safe, but for example,
Knee replacement
surgery. If you're planning to do a knee MRI, and especially if you have a knee replacement surgery, you expect the images to be of suboptimal quality because it's a metal. It will cause significant distortion in the image. You will not come up with a good quality image. But if you have a knee replacement and your request is for a spine MRI or a brain MRI, it's not a problem. But I'd like to emphasize the issue of metal objects or foreign metals, foreign metal in the eye or in the body that can move inside the magnet and cause tissue injury. So it's important to tell the technologist before the exam that you expect to have a metal object. They may send you for an X-ray to look where's the metal object. Is it really a significant thing or not? So we frequently send the patient for a skull X-ray or a chest X-ray or an abdominal X-ray to look for a piece of a bullet or a metal shrapnel from a previous explosion or something.
I think back to the same point, MRI, because patients should be given clear instructions about MRI, because some patients they have phobia of, let's say, closed spaces, agoraphobia we call it.
Claustrophobia.
Claustrophobia. So what about this? Is there any open MRI nowadays, or
well,
I think that's important
as you know,
point.
the MRI machine is basically a tunnel, a tube.
Okay.
The patient goes inside, and it's a very tight space. So some patients are very uncomfortable in tight spaces. So they may not be able to continue the exam. They have a panic attack during the scanner. So yes, we have there's something called an open MRI, open magnet, where it's wider. It's not round. It's not like a tube. It's basically like two planes, one behind and one above the patient, and the sides it's open. So the patient feels more comfortable inside it. He doesn't feel enclosed in a tight space, and also it can be used also sometimes for patients who do not fit inside the obese patients who do not fit inside the regular MRI. They might fit inside an open MRI. But of course the quality of the images is not as good as the closed. So if you have an option to go to one of them, go with the closed magnet. If you don't feel comfortable, there's an option of open magnet, but it's not available everywhere.
Excellent. What about movement during imaging? Movement, does it affect the quality of imaging, or?
Well, it affects some modalities more than others, but most of them, yes, it does affect the X-ray, affects the ultrasound, affects the CT, and affects the MRI. But it's more noticeable in the MRI because you have to stand still in MRI for about a minimum of 30 minutes without movement. Any
30
movement,
minutes, so that's, you have to be patient.
Yeah. But in CT scan, the scan takes about a few seconds. So if you can stay stable for without movement for that period, that's perfect. But it's more difficult in MRI because it's at least 30 minutes without movement. It's not easy.
That you have covered nicely that how do we prepare for ultrasound, CT, MRI. What about nuclear imaging or nuclear medicine?
Yeah, well, the nuclear imaging is not just one examination. It's a spectrum of examination. Some of the examinations evaluate the thyroid gland, some evaluate the lung, the vessels of the lung, some evaluate the bone, the kidneys, and the brain. So each modality has its own preparation. Some of them require the patient to stop his medication for a period of a few weeks before the exam, like the thyroid medications. Some require the patient to be fasting. Some need the patient's blood sugar to be controlled, like in PET-CT, which is part of the nuclear examinations. So to know what kind of preparation, ask the front desk or the technologist or even your physician on how do I need to be prepared for this examination. We have many patients who do not read the instructions written in the appointment slip. So they're given a paper with instructions. They don't read them. They come to their appointment. They're not prepared. So either the exam becomes of low quality or it cannot be performed. So always ask about what kind of instructions do I need before the exam, and read the appointment slip that's given to you. If there's any special instructions you need to follow.
I think just one relevant example that urea breath test for H. pylori. It's kind of nuclear imaging. If the patient
he needs to stop some of the anti-acid medications before the examination, and some antibiotics, and I think also smoking is also needs to be stopped before the examination. Yes.
And again, for the bone mineral density examination,
they need to stop any calcium or vitamin D they're taking, so it will not affect the quality of the exam. Exactly.
So important, not only imaging itself, so the preparation, the instructions, if not followed, might affect the quality of the examination. Yes. We'll come to another important question. What are the commonest myths about medical imaging that you encounter in your clinical practice by patient?
Well, we face many myths. One of them is the issue with contrast media. Contrast media is basically, the layman term for it is dye. D-I-E. It's not dye from death.
Sure, yes. Okay.
So it's something that can be given to the patient through the mouth or through any orifice. One of the commonest modalities where we introduce contrast is through the vascular structures. So one of the common myths, patients think that the dye is some kind of toxin that will kill them. It's not like chemotherapy or something. It's not. It's quite safe if it's done if it's given in the appropriate dose, and it's given to the right patient. So because contrast, the IV contrast is excreted from the body through the kidneys. So if the patient has abnormal renal function, if he's diabetic, it might cause some acute kidney injury. Some patients might have allergy from it, but it's a very small amount of patients, and they are screened before they are given this contrast media to make sure they will not have this harmful effect. So no, it's not a poison. It's very vital. It's very important. Some of the radiologic examinations, if some of the exams if done without IV contrast, they're useless. So you can ask the technologist, you can ask the radiologist about the expected side effects, but if the physician decides it's better for you, then it's most likely will be beneficial to you. Yes.
Excellent. That just I have analogy. That if you have a picture white and black, this is like imaging without contrast. If you have with the brightful and colorful, it's like contrast. Is it
yeah, you're right. The aim of IV contrast given to that's injected into the patient's vessels is to go through the vessels into different organs. So these organs will appear as high density on the or brighter in the CT scan or even in the MRI. So it will be able to show us where is the diseased tissue and where is the normal tissue. So we know how does the normal tissue take up this contrast, and how does the abnormal tissue take up this contrast. So yes, you're right. The contrast enhances increases the density in the image. Yes.
Excellent. Now this question is closely related to the previous question. What are the potential complications of medical imaging apart from, side effect of contrast?
Yeah. Well, Ionizing radiation can have some mild harmful effect. Starting with X-rays, conventional X-rays, it's ionizing radiation. The amount of damage caused by it is very minimal and negligible. It's so low. You can do it even to pregnant patients in the right clinical setting, of course. The radiation dose in a CT is much higher than X-ray. One CT scan of the chest is equal to 300 X-rays. And the CT scan of the abdomen exposes the patient to what we call 20 millisieverts of radiation, about 20 millisieverts, a routine abdominal CT. How much harm does that cause? If you expose, for example, 100 patients to 100 millisieverts of radiation, you might cause 1 case of cancer.
1 case of cancer, okay.
1 case of cancer. So that's an interpolation. It's not, we didn't observe it, but it's something being calculated. But again, we weigh the risk over the benefits, and if the benefits to do the examination, it's most likely better to do it. Now, with emerging techniques and technologies, the radiation dose from different X-ray different radiological modalities are getting less and less and less. So you get a diagnostic examination with even less radiation. Especially, this is an issue especially with children and pregnant women. I remember during my medical school, CT scan was an absolute contraindication during pregnancy. Now it can be done safely to pregnant women, especially if it's done for the chest, if it's done in the right technique and in the right clinical setting, if the patient really needs it.
So, I mean, the pregnancy, this is very important topic. Pregnancy per se is contraindication for medical imaging. What are the safest, imaging modality? And we need you to elaborate on this, very important. I'm sure all, dear viewers are interested to hear about this.
Yeah. Well, the safest imaging modality during pregnancy is ultrasound. Okay. There's no proven harm to the mother or to the fetus from doing an ultrasound, but yet it's not advised to repeat it unnecessarily. But that's the safest during pregnancy. The second safest is probably MRI, magnetic resonance imaging. The MRI itself has no ionizing radiation. It has a small amount of energy deposition from the magnet itself into the mother and fetus, but there's no proven harm to the fetus. But again, if it's not indicated, we don't recommend doing it. The MRI contrast media is categorized as FDA category C, meaning that it's been noticed in animals at very high doses or prolonged exposure to cause some teratogenic effect to the fetus. So we don't recommend giving MRI contrast media to the patient.
So MRI alone is
it's fine.
It's fine.
It's fine. It's even safer as you go further along the pregnancy. So the third or second trimester is very safe. The first trimester, it is safe, but if you can avoid it, it's better. Now going to CT scan
or X-ray.
Or X-ray. X-ray can be done safely during pregnancy. Yeah, the amount of radiation is negligible compared to the benefit the patient gains. But we don't do it every day, of course, for reason or without reason. There has to be a strong clinical indication. And
if you allow me, Dr. Abdullah, to pause, and we'll come back to this very important question. We will go for a report. That report will be talking what's getting an MRI like. To watch more details about this report, stay with us.
Hi, I'm Angie, and your doctor has ordered an MRI, and I'm here to show you exactly what the MRI machine looks like and what it does. What it does is a big camera that takes a picture of the inside of your body. How it works is you will lay on the table, and the bed will move up, and it will go in, and it will take pictures just like you would with a normal camera. It just looks a little bit different. Once you're in the camera, it doesn't hurt, it doesn't spin around on you, or it doesn't close in. All it does is make a really loud noise, and that noise does not hurt. It's just very loud. So a lot of the time the kids will listen to music or put headphones on, and this is what these look like. And I want to show you on a little model. So this is kind of how the machine works. We shrunk it down to show you exactly that you will lay on the bed. There will be a place there for your head, and you will lay right there. And the bed does move, and it will move into the camera, but your whole body will not go all the way in. And it does not close. It does not have any doors. You can see all the way through it. This part of the camera also does not move. Nothing spins around. All it does is make really loud noises. And again, the ladies will let you wear headphones or listen to music. When you're in here, you will always hear a little bit of a sound. Some kids like to say that it sounds like a bird chirping or like a car humming, and that is normal. If the doctor has ordered to get a picture of your brain to look at the inside of your head, this is part of the camera also, and it will slide over your head. It kind of looks like an astronaut helmet, or it looks like a football helmet. And it does not touch you. It just goes on the outside of the pillow that you will already be laying in. And when you're lying there, there's a mirror here. So you will be able to see whoever is with you by just looking up with your eyes. We don't want you to move side to side or up and down. If you move while you're in the camera, it will become blurry just like a normal camera would. So you can look with your eyes and see whoever is standing out here so that you're not alone. And if you choose not to listen to music or to have the headphones in, they also might use little pillows like this, and they go right next to your head. They're nice and squishy, and that just makes you more comfy and also makes it harder for you to move your head. Because again, your job is to lay very still, as still as you can, without moving your head around so the pictures are not blurry. And now we're going to show you exactly how the bed works and what sound that the camera makes so that you're not afraid of it. So the patient will lay on the table, and there's a nice soft spot for the head. And we'll make you as comfortable. If you would like a blanket, we can do that. We put a pillow under the legs just so you're more comfortable. And these are the headphones I was talking about. You can either listen to music or just have the headphones on. That also helps your head not wiggle around, so again, we don't have blurry pictures. So the table's going to go up. It's kind of like a little elevator. And then next, the helmet will come down, like the astronaut helmet that we talked about. And you will see that it does not squish her. And then next, the helmet will come down, and that is part of the camera as well. Looks like an astronaut helmet like we talked about. It does not touch your head and does not squish anything. And you have the mirror there where you can look straight up with your eyeballs and see anybody who is out here with you. And then the bed will go in, and that moves a little bit, and that is the only part once you're here that moves. And once you are in position, the camera will start working, and it is very loud, and that's why you have the headphones or the music on. A lot of the kids like to say that it sounds like a construction site, there's hammering, jackhammer, or like a rocket ship going into space. It's very loud, but again, it will not touch you, and it does not spin around, and it will not hurt when you're getting your pictures taken. So you hear different knocking sounds. The camera makes all sorts of different noises. Not all of them are the same. And again, that's just the camera taking pictures. She's fine in there. She can see me in the mirror, and she's doing great. If your loved one was with you, they can touch you and make sure that they know that you're there. And that is what one of the sounds sounds like. Just taking pictures and just laying there super still. I just want to remind you again, when you're inside the MRI scanner and it's taking pictures, be as still as you possibly can so that we can get the best pictures and the doctors can find out what's wrong.
Once again, welcome back to Elixir of Life. Our topic, the role of radiology in diagnosis and management of disease. And welcome back our distinguished guest, Dr. Abdullah AlDosary, consultant radiologist. Welcome, Dr. Abdullah.
Thank you very much. Thanks.
Just back, we paused on a very important point, the pregnancy and medical imaging. And you discussed ultrasound, MRI, and you stopped in the X-ray. What about the X-ray and the pregnant patient? Because many patients, when they hear just X-ray or plain X-ray, they refuse completely because they think it's 100%, causing fetal abnormality or malformation?
Well, I don't think the patient will reach the point where she will need an X-ray unless the physician already assessed her and weighed the risks over the benefits, and he thought the X-ray risks are very minimal compared to the amount of benefit he will get from the information from the X-ray. So no, not every X-ray will cause cancer to the patient or will cause harmful effect. It's extremely low, negligible, and it's nothing to worry about.
Mm-hmm. So if it is indicated, it should be done.
Should be done,
okay.
yes.
And the patient should be reassured.
Yes.
What about CT scan?
Well, yeah, CT scan. Well, the amount of radiation from the CT scan to the fetus is very negligible, especially that during X-ray or CT scan in pregnancy, we take extra precautions. We limit the radiation dose, we change the technique, and we put lead shields on the tummy of the patient, and we modify our scan so they can limit the radiation to the fetus. With all these precautions, the amount of radiation reaching to the fetus is extremely small, and the amount of benefit we will get from the CT scan in these kinds of patients is very high. So no, it's quite safe to do it with minimal risk to the fetus.
Thank you, Dr. Abdullah. I would like to just briefly the take-home message from your important, interview.
Okay. Well, my message to any person who is at the doctor's office and the doctor thinks that he needs the radiological examinations, ask your physician, what kind of radiologic examinations do you need? What should I expect during the radiologic examination? How should I prepare myself during the radiologic examination? If the patient is pregnant, tell your physician that you are pregnant. If you have the radiological examination that you did it in another center, bring it to the physician's office. Show it to him. He may need to have a second look at it. And at the X-ray department, you feel free to ask any question to any of the staff in the radiology department about what kind of examination is this, and what should you expect during the scan. How should you prepare yourself before you come to your appointment? And after you finish your scan, you feel free to ask the technologist what to expect. Are there unexpected side effects of the procedure later on? And go back to go back to your home. Come to your next appointment with the physician. By that time, your radiology report should be ready after being reviewed by the appropriate radiologist.
Thank you, Dr. Abdullah, for enlightening and informative episode. It was wealthy discussion, and we wish to see you again in our program. Dr. Abdullah AlDosary, consultant radiologist. Welcome.
Thank you very much. Thanks.
Okay. Now we are coming to the next segment. We'll be talking about health benefit. To watch more details about this report, stay with us. Once again, welcome back to our program Elixir of Life. Now we are coming to the end of our show. Before I conclude, ladies and gentlemen, dear viewers, I would like to thank our great team for their great effort, and we wish you have enjoyed watching our episode and found it useful. Until next week, we wish you a pleasant week ahead. We are looking forward to seeing you next week. Assalamu alaikum wa rahmatullahi wa barakatuh. Goodbye.